Honorable Chair, distinguished panelists, Excellencies, ladies and gentlemen, it's really a pleasure to be here today. It has been almost 20 years since member states around the world gathered in Cairo to adopt the ICPD Program of Action. And in adopting the ICPD Program of Action, 179 countries committed to actions that were intended to bring about transformational change over the next 20 years. However, in spite of the repeated affirmation of its goals and objectives over this period, the implementation of the Program of Action has been uneven. In recognition of this, at the 2005 review of the MDGs, universal access to reproductive health was reinstated into the development agenda, as had been envisaged at the Cairo conference. However, by this time, valuable funding as well as time had been lost, particularly for family planning programs, and maternal mortality today remains a serious concern, with MDG 5 continuing to be the MDG least likely to be achieved in most countries around the world. In 2010, the UN General Assembly, recognizing that the Program of Action will not be achieved by 2014, extended the deadline for the Program of Action until it is fully achieved. And this resolution calls on the 179 signatory governments to recommit to achieving the goals and objectives of the Program of Action. Specifically, the resolution calls for the convening of a UN General Assembly special session in 2014 to assess the status of implementation of the Program of Action and to renew political support for actions required for the full achievement of the goals and objectives. The resolution reaffirms that the special session will be undertaken on the basis of and with full respect for the Program of Action, and there will be no renegotiation of the existing agreements contained in the Program of Action. The resolution also calls upon UNFPA to undertake an operational review of the implementation of the Program of Action on the basis of the highest quality data and analysis of the status of population development. The Secretary General will submit a report based on this review to the Commission of Population and Development at its 47th session in 2014, as well as to the UN General Assembly in the same year. As you know, during the same period, the MDG review process has also now commenced, and discussions are underway on the post-2015 development agenda. And this really gives us a unique opportunity to further strengthen the integration of population and development into the broader post-2015 development agenda and to ensure more meaningful and sustainable development outcomes. In fact, I believe that as we are in this conference today, there's a parallel meeting going on the post-2015 development agenda in Dhaka today. This conference does come at a very opportune time in terms of providing a platform that allows for an open discussion on the challenges and achievements, and it provides us an opportunity to really reach a consensus on the priorities and the way forward. And all of this can feed into the ICPD beyond 2014 and post-2015 development agenda. The declaration that will be developed and adopted at this meeting will certainly constitute a critical input into the global review processes for both the ICPD and the MDGs. Just a few words then on the ICPD process. Firstly, it is important to mention that this review consists of several interrelated activities, including a global survey and a number of thematic global meetings, as well as regional conferences. Some of the thematic meetings, for example, there will be a global youth forum in Bali in December this year. And next year, in May of 2013, in Kuala Lumpur, there will be the Women Deliver Conference. The global survey is currently underway in countries, And it looks at what factors have really supported or hindered the delivery of the ICPD program of action in countries. It looks at policy issues, it looks at governance, the issue of national ownership, coordination mechanisms, resources and management. At country level, with the support of the UN regional commissions and UNFPA, governments are responsible for managing the survey process and ensuring, as called for by the GA resolution, that this is a fully participatory process and it involves all the key stakeholders, including civil society. Most countries have either completed or are close to completing the survey, and the UN regional commissions will then prepare their regional reports based on the country results, and these regional reports will be the basis for the regional conferences that will be held next year. The regional commissions and UNFPA will make every effort to ensure that the global report captures all this rich information, data, and analysis from the country, regional, and global events, including this important meeting, and that this information really feeds into the global report. So what is the ICPD Beyond 2014 vision? Well, we will certainly have greater clarity on where the gaps are and what specifically we need to focus on once we have the country reports and the analysis of those. But we also need to acknowledge the achievements and successes in countries so that we can build on them. Since 1990, have access more couples to contraception and are able to plan for the number and spacing of children they have, and more women are receiving antenatal care and skilled attendance during delivery, resulting in a decrease in global maternal deaths by 32%. But we still have considerable unfinished business, and our keynote speaker gave us a very good overview of that already. Despite the successes in some countries, when we look at the national indicators, we also recognize that inequalities exist in relation to accessing reproductive health services, and that, in fact, in-country disparities are widening. As mentioned earlier, globally, there are still over 200 million women with unmet need for modern contraception. The poor, the rural, those with minority ethnic groups, and socially excluded, the young, are especially at a disadvantage in terms of accessing reproductive health services, including contraception. We need to turn our attention more to addressing the barriers faced in increasing contraceptive use. These barriers include lack of women's empowerment to make decisions related to contraceptive use, poor quality of services, including counseling, myths and misconceptions about various methods, as well as limited choice. Within 20 years, we are still struggling to address these barriers. And the Family Planning Summit that was held in July this year in London really brought a lot of attention to these issues and created a new momentum to refocus on family planning. Early marriage and early fertility is also a concern. With half of the world's child brides, some 4.5 million girls living in South Asia in this region. Girls who marry early are deprived of their rights to make choices that affect their lives, including completing their schooling and having the opportunity of making a better living. Married adolescent girls have the highest level of unmet need for contraception, and maternal mortality is the leading cause of death in girls of this age group. Yet this need is still not being addressed in the vast majority of family planning programs in many countries. Every day, approximately 1,000 women die from preventable causes related to pregnancy and childbirth. And although in this region, for instance, we've seen a reduction in the last decade, South Asia still ranks the second highest in the world in terms of maternal mortality. And this really is a reflection of weak and fragile healthcare systems which have not been able to provide women with the continuum of skilled care that is crucial to reduce maternal deaths. Maternal mortality, in fact, represents one of the greatest disparities between rich and poor countries, and between the rich and the poor within countries. Hence, we must ensure that universal access to reproductive health services secures a central place in the post-2015 development agenda. And this will require political commitment to make health and well-being and protection of women and children a national and a global priority. It has been estimated that access to family planning, combined with ensuring skilled attendance at birth and emergency contraception care, would reduce maternal mortality by 75%. More also needs to be done in relation to innovative financing, and there are certainly a large number of countries that are pursuing different schemes and approaches that have contributed to increasing access to reproductive health services, especially for underserved communities. I also want to just reinforce the importance of strengthening partnerships between governments, but also partnerships between government and other stakeholders in countries, particularly civil society, and also expanding partnerships and innovative arrangements with the private sector. In recent years, UNFPA has intensified its support for South-South cooperation in recognition that it is one of the most effective approaches to building sustainable capacities in countries. A great number of South-South exchanges have occurred in the last decade, and they've been provided great value added to both the provider countries and the recipient countries. In UNFPA, our goal is to move towards facilitating more long-term partnerships with strong government leadership, and also offer support in identifying niche areas and partnership opportunities for the provider countries, while ensuring that they are also sensitive to the context and needs of the recipient countries. UNFPA has been proud to have supported the work of partners in population development, and we wish it continued strength and success in achieving its mission and mandate. The ICPD and MDG review processes provide an opportunity for those who can influence change and those who can shape the future of the development agenda. It gives you an opportunity to play a role in ensuring that every pregnancy is wanted, every childbirth is safe, and that every young person's potential is fully realized. Thank you very much.